Hello everyone. Today I just wanted to update everybody about a little bit about what's going on in the industry and some things that I thought were really interesting that I kind of knew in the back of my mind, but figured I would talk to you folks about it because it did become very apparent to me recently in handling my own medical bills and also things that I found online. So let's take a look. So what I wanted to talk about first is this new hospital price transparency. So CMS, hospitals, they've all kind of tried to make price transparency a thing so that when you get any service, then you kind of have a good idea of what the hospital is charging you. Unfortunately, it doesn't really work, as you can see here. This is put together by the American Academy of Actuaries. And this article or this issue brief pretty much talks about how the data is not perfect. And this is not the answer, meaning that price transparency isn't really going to provide patients, provide people who require healthcare, participants in the healthcare system, a more or a better system. For lack of a better term, this price transparency, while it is a step kind of in the direction of providing more transparency, it does not address the problem of high costs and just the overall surprise of how expensive services are. So one thing I thought was pretty interesting was the direct for primary care. Some of my clients participate in direct primary care. It's concierge care, MDVIP, where you pay your primary care physician a retainer and such. They will take care of you. Whatever billing things that you might have are all covered in this kind of one price per month fee. And that is kind of, in my opinion, that works well for the healthcare system for that doctor, because now that doctor can be pretty much knows business-wise, from a business standpoint, how much money comes in and how he or she is going to pay their staff, pay for the lights, pay for electricity, all those fixed costs. So that is something that I think needs to happen for hospital systems as well. Maybe insurance companies can have a fixed cost that insurance companies need to pay the hospital to be a part of the plan, and then have all the members covered in that plan. And I don't write policy, I just comment on this. Again, what I was talking about with the second part of what I wanted to talk about today was the surprise billing and how insurance companies, hospitals, and clinics kind of manipulate the price and force people to get insurance. Many times I tell my clients, for dental, you don't need any insurance. And also I tell people, if you go to the pharmacy, ask them how much the cash price is. One of the main things that I've just recently become aware of is I had a video visit. And in the video visit, my insurance company says that my video visit is $30 copay, right? A $30 copay to have a 15-minute video visit. Upon looking at my bill, the visit costs $210, but there's an insurance adjustment that adjusts the cost of the entire visit by about $130 or so. So in the end of the day, I pay $30, my insurance company pays about $40 for this video visit. So I thought, wow, that's interesting. There's an insurance adjustment. And then my daughter had the same video visit, but for some reason they didn't bill it through insurance. They just billed it directly to me. And the direct to me cost was the entire non-discounted $210. And when I went to call them up, they said that because we didn't use any insurance, you're going to have to pay the $210. And fortunately, I let them know that that's not the case. We would like them to use our insurance. That's why we have it. So that's what we did. And that same thing, that same discount, if you have insurance, extends through every single metric or every single facet of the insurance or of the medical system. So hospitals, it's the same way. I have a picture here of a hospital bill that discounted nearly 50% just because this patient had insurance. If this patient did not have insurance, they would have received a bill for the entire amount, non-discounted, like how I did for my doctor visit, right? Or my daughter did for her doctor visit. Also for dental, and this is kind of where I might have to backpedal a little bit on what I said, where if you have a dental insurance plan, like it says down here, that network providers have agreed to charge 25 to 50% less. Remember, 50% less, right? So hospitals and doctors and everybody mark up their retail price because they know that by participating in this network, they're going to have to decrease their price for whatever services that they include in their in their practice. So with that said, I think that most folks should actually be enrolled in some kind of a dental plan and see network physicians or network contracted physicians, because what that does is it puts the patient, the member of the plan, in a more advantageous position as far as bargaining power. What does that mean? Well, if you're all alone and you see the dentist can charge you, or the physician can charge you literally whatever they want if you have no insurance, right? That's one of the problems with our medical system. But if you do have insurance, then now you as a patient are informed as to how much things actually may cost. And I'll give you an example here. Emeritus has this wonderful thing called the dental cost estimator. And this is how much things cost when you do it outside of network, based on zip code. I'm using zip code in Hawaii. And you can see this is about how much these particular services cost in this zip code. And these numbers are based, I believe, in 2018, so kind of old numbers. But you have at least an idea of how much things cost. So when you get them done, and let's say you get this implant mini placement done, and you're charged $3,000. And you're like, there's no way. Like, how can you charge me 3 times what the average cost is in my area? Now you have something to show the dentist, like, hey, you're overcharging me. And now you can say to friends, to review sites, that his doctor charged me way over the usual customary amounts, because you know what the usual customary amounts cost. And that's one of the things. I know it sounds like doesn't sound good that they're charging over than what they should be reimbursed. But that's unfortunately the world we live in, and we have to kind of make these adjustments because these kinds of things happen. So in the past, I would say, just forego the insurance and just pay cash. Now I'm thinking that you may want to get the insurance, because a lot of times when you go for oral surgeries like implants, dentures, things of that nature, higher cost dentistry, or higher cost hospital services, you are going to be referred. And if you have insurance, you can go to an in-network supplier of said service and get a better fee or get a better rate, even if it's going to be expensive. I mean, these services are expensive here. $3,000, $4,000, but at least ballpark where it's going to be, and that you'll get some coverage, and that you're paying what is, I guess, an average versus whatever the dentist or the physician feels like, or office feels like charging you. Now, I'm not saying that everyone's in it to rip you off. I'm just saying you, as a customer of healthcare, as a patient, should try your best to at least be somewhat informed and get ballpark figures. And it's really difficult because the internet says tons of different things. Heck, I'm on the internet telling you a ton of different things, right? But from having first-hand experience, I thought it'd be a good thing to tell you folks. Especially you folks who are on Medicare, you have the benefit of that group-based kind of pricing power. And Medicare actually has a really, really good resource. Let me go ahead and show you a few of them while I open this up. Hang on. All right, here we go. So this is all the procedure codes and all of the average submitted claims, how many beneficiaries took advantage of this surgery or this procedure nationwide. And I know it's a whole ton of decimals, but average payment that these things cost. And one thing to kind of take a good look at is right here. So I'll try and zoom in a little bit, but this is how much the claim costs, or how much the doctor puts in as this anesthetic claim, almost $2,000. Medicare only allows $237 of that entire almost $2,000 claim to be charged. That's how much Medicare allows. And of that, Medicare pays about $187, right? That's the 80-20 plan of Medicare. So the patient is left with the difference, about 60 bucks. So as you can see, this $2,000 procedure is actually discounted all the way after Medicare pays to about $60. If you did not have Medicare insurance though, you would be looking at this entire amount billed to you, and you then yourself would have to go and quote unquote fight the insurance company. And one last thing to take a look at is right here on original Medicare Part B. These are all the outpatient services that require, so Medicare Part B services that require a prior authorization. So you can check here to see if your doctor has to put in any kind of prior authorization services to get any of these things covered, right? So it's very transparent already. It's just a matter of having that information for you that you can go ahead and get. And on the Medicare.gov, if you sign into your Medicare.gov account, you can actually see exactly how much your services were billed for and everything. So Medicare is doing its best to help facilitate all this through. It's just a matter of being kind of knowledge. And if you've been with me for this entire video, I thank you. You can subscribe to this channel. I do post things about investing, finance, mostly about Medicare and medical insurance. But if you have questions that you want me to answer, you want me to review something for you, please do ask me, leave it in the comments, send me an email if that will make you feel better. And that way I can go ahead and answer them. And if you have that question, there's probably a whole ton of us that have those questions. So send them in. I'll be doing my best to answer them whenever I have time. And I'll see you folks in that video. Have a great week, great day, and I'll see you in the next one.